Discover the latest health tips, expert advice, and inspiring stories. This is the Health Channel Podcast. Your journey to better health starts now.
We know respiratory issues are common in humans, but did you know that they're very common in our pets as well? On today's show, we will look into causes and treatments of animals' respiratory illnesses. And as always, we are here to answer your questions. All that and more coming up on this episode of Ask the Doc, No Appointment Needed. Hello, and welcome to Ask the Doc, No Appointment Needed, the show where the questions you send in are answered by our doctors and medical experts. I'm Dr. Joy Carter, Doctor of Veterinary Medicine, and thank you so much for joining us today. Let's get right to your questions. All right, our first question comes from Hunter, and he emailed us and asked, my sister works at a local shelter, and she told me recently about an outbreak of respiratory illnesses at the facility. What are these? What causes them? And what do I need to do to protect my pet? All right, Hunter, thank you so much for writing in. So yes, definitely respiratory illnesses and infections are very common in pets, specifically in a lot of times shelters, because you have a lot of pets that are there. They're in a very crowded environment. They come from a lot of different places, some off the streets. A lot of times their immune systems are very compromised. And so, they are just more easily to get infected. First thing I want to talk about are the common pathogens associated with what we call canine infectious respiratory disease complex in dogs, okay? The most common ones that we tend to see, and the number one I would say would be the first one is Bordetella bronchoseptia. So it is a bacterial infection, also kind of known as kennel cough, or can be one of the things that could cause kennel cough. It is definitely something that can be vaccinated for, okay, depending on the lifestyle of your pet. If they're boarded, if they get groomed, different things like that, your vet, he or she will talk to you and see if they recommend that vaccine. Another one is obviously canine parainfluenza virus. That also, as it says, it's a virus, but it also is something that can be vaccinated for in the typical vaccines that we give dogs. The next thing is we actually do see influenza in dogs, okay? There's two different subtypes of that. The first one is going to be H3N8, and the other one is H3N2. And there are two different vaccines, or there may be one vaccine now that does for both of those subtypes, but those are the most common types of influenza viruses that we see that infect dogs. Some other things are your canine distemper virus, which that one, it usually will start as respiratory signs, but it can progress to neurological signs and it can be deadly. This one is 100% preventable with vaccines. Some dogs can survive if they do get distemper virus, but a lot of times they will have residual neurological signs. They can have seizures. They can have kind of tics or twitches, different things like that. So definitely, something that you want to, obviously, this is part of the yearly vaccine, or when you get the vaccines every 3 years, depending on your pet, things like that, something that they vaccinate against for. Another one is canine adenovirus type 2. Obviously, another virus that we also vaccinate for. Okay. And then the two main last ones that we tend to see are going to be canine herpes virus type 1. Now, it's not the herpes that we think of in humans. Okay. This is one that causes respiratory issues. And then the other one is a bacteria. So this one is called Streptococcus zooepididymis. I can't even hardly say it today. Sorry. But so this actually is an opportunistic infection. We typically tend to see it on cattle and on horses, livestock and things like that. But animals that are immune compromised, in particular dogs, they can get infected with this bacteria and it can actually cause problems. Now, I don't know 100%, but I do know that a lot of shelters have had some outbreaks of this type of bacteria, what we call like strep zoo. I don't know if in particular the animal shelter in Miami-Dade or anything like that, if that's the issue that they're having right now, but I do know that it is a problem for a lot of shelters. Normally, for most pets, it does not cause an issue, but you have dogs coming in from all over different places. And then once again, their immune system is compromised, and then this opportunistic bacteria can cause infections. Now, the next thing is we've got some common respiratory pathogens in cats, okay? The first one is going to be what we call feline herpes virus, type 1. We also call it sometimes feline viral rhinotracheitis. The reason why we call it that is because a lot of times it does cause issues with the nasal passages, like sneezing, runny nose, so that where the rhino part of it comes. And then the tracheitis it certainly can affect the upper respiratory system, like the trachea, basically kind of like your windpipe. And this is something that obviously, that it's very common in cats. I would say probably 90% of cats out there have been infected with feline herpes virus. The thing is it lies dormant in the system. And then when a cat is either stressed or immunocompromised, that is when they can become sick with it. There's nothing you can do really to prevent it per se. You can try and vitamins and keep your cat as stress-free as possible. But usually when they do have an issue with it, the good thing is very self-limiting. And what that means is that they usually can get over the infection themselves. Now, sometimes we will put them on antibiotics, but technically it's a virus and antibiotics don't do anything for virus, but sometimes the viruses can suppress the immune system and then it can cause them to, get secondary bacterial infections. Another really common virus that causes respiratory signs is going to be feline calicivirus. And this is another one that is very, very rampant in your everyday cat population. Majority of your cats are probably been infected with this. And the same type of thing. When they get stressed, immunocompromised, that is when they can have an active infection and stuff. The next thing that we tend to see is something called feline chlamydiosis, okay? That can certainly cause some respiratory issues. Actually, the bacteria that we see in dogs, the Bordetella bronchoseptia, you can see that in cats. And then there definitely are some other kind of like fungal infections and things like that can cause respiratory issues and stuff. So I know that was a lot of information. Hopefully that kind of helps answer your questions. There's a lot of different respiratory pathogens out there, but these are going to be your most common ones, all right? All right. So our next question comes from Wanda, who emailed us in with this question. All right. I have an 8-year-old Yorkie that is a little overweight. Recently, I've noticed she will make this honking-like cough when she gets excited or while on a walk. What do you think this could be? And should I be concerned? All right, Wanda, thank you for your question. So without actually physically seeing your dog and do a physical exam, I can't say 100%, but my suspicions are that your dog may have something called collapsing trachea, or the technical kind of medical term is like tracheovalacia. Like there's all kind of different words out there, but basically what it means is that the trachea, your windpipe that basically air goes through, it can collapse. All right. And when it collapses, they will make a lot of these weird noises. It can sound very honky-like. It can sound like a goose. They kind of will describe it. Just can be just like a really annoying dry cough. So your trachea is made up of rings, okay? Kind of like this. They're cartilage rings. They don't go all the way around the trachea because the trachea is a tube. And so in certain breeds of dogs, and as they start to age, that cartilage can kind of become what we call hypoplastic. So not as stiff and as firm as it should be. And when that happens, kind of the trachea can kind of start to sag a little bit. And that's when we can see that they have these issues. is pretty easily diagnosed. Okay. Typically, a lot of times, just even hearing a dog having a collapsing trachea episode can be enough, but radiographs are really kind of the standard to diagnose it. You can do even fluoroscopy, which is kind of an x-ray in real time and things like that, but that's going to be more kind of at a specialty hospital. The good thing is that I would say the majority of dogs can be managed. All right. You can't get rid of it. All right. But it can be managed very well. Usually we will put them on cough medications, sometimes anti-inflammatories to help with any inflammation. Because when they're coughing, it causes more inflammation and then it causes you to cough more. Sometimes we'll even put them on bronchodilators to help open up the lower airways and things like that. Sometimes even just lifestyle changes. So if you've been using a neck leash, we'll recommend switching to like a harness. Also too, like if they happen to do it when they get very excited, when there's company coming over, we will use kind of sedatives or kind of anti-anxiety medications to help with that. And one thing too that definitely contributes to it is you've got those little toy breed dogs that are nice and chunky and fat. Unfortunately, the fatter the dog is, the more pressure it puts on the neck and the more pressure it puts on the trachea. So definitely trying to get your dog to lose weight is one big thing. Now, really severe cases of it, there is a surgery that can be done. There can be a stent that can be put in the trachea. That is for very severe cases, and it's thankfully not often done. So the best thing for you to do, Wanda, is to take your dog to the vet, and just have a checkup. And if he does have collapsing trachea, they'll be able to diagnose it. They'll be able to talk to you about what your treatment options are. So, okay. All right. So our next question comes in from Jennifer, who asks, all right, I recently boarded my dog at a doggy daycare place and he came back with a dry cough. Do you think it's kennel cough? He's been vaccinated. What should I do? All right, Jennifer. So yes, it certainly could be kennel cough. You definitely want to make an appointment with your vet to get him checked out. Now, I talked about kennel cough. It's the bacteria Bordetella bronchoseptia. Even though they are vaccinated, the vaccine is not 100% effective. It's kind of like the flu vaccine in humans. And the fact is that it can sometimes prevent them from getting infected. But if they do get infected, usually it helps lessen the course of the disease. So they kind of don't get as sick type of thing. So best thing to do is take them to the vet. The good thing is it's easily treatable, usually with cough medication. And sometimes we'll put them on an antibiotic, usually doxycycline, to kind of help get rid of the bacteria. So good luck with that, Jennifer. And hopefully it's not kennel cough, but it is. Just remember that it's easily treatable. Okay, we got a question from Leslie, this time from our Facebook page, and she writes, my dog is on meds for a respiratory infection. I am concerned about him if we have to evacuate because of a hurricane. What tips can you provide to keep him safe and healthy? All right, Leslie. So, as far as with any type of medications that your pet is on, we've always got to kind of be prepared. I think we're kind of currently at the very end or hopefully getting out of hurricane season, or we may be already out of it, but you just want to have those medications that they need to be on just accessible and readily available for you just to kind of pick up, and grab and be able to take, just like you would with your own medications. So hopefully that doesn't happen. Okay. But, if it does, just remember, have the meds at a easily accessible spot. And that way you can just kind of grab and go. You could even use one of those little pill containers that we have in humans. And you could put like a week's supply of meds. So literally you just take that and you go. Okay. So, all right. Madison followed up with her email and she writes, my cat occasionally coughs like she's trying to get up a hairball. Should I be concerned? All right, Madison. So yes and no. Okay. Definitely it could be that your cat is trying to cough up a hairball. All right. And that's usually not anything life threatening, but also too, there is something called feline asthma. All right. And feline asthma is definitely can be a life-threatening condition if they start to have a very bad asthma attack. And sometimes the signs are very subtle in cats. Certainly having a cough is one thing that you will see. Certainly having some wheezing episodes, things like that, changes sometimes in their pitch or like how they meow, like basically their voice could change. More serious signs can be increase in respiratory rate, increase in effort, using their abdominal muscles more. And then when they are having like a asthma attack, these guys can have severe respiratory distress. They can be open mouth breathing. They can be, mucous membranes turning kind of blue, purple, like cyanotic type thing. Okay. The good thing is that it can be managed. Okay. Usually there are two top, medications that we use to manage feline asthma. The first one is going to be your albuterol or a bronchodilator, just like they use in humans. Okay. And that can be given via a special like inhaler. It's called like an Aero cat or an Aero dog. They actually have it for dogs. And that's used for acute respiratory attacks because as a bronchodilator, it helps open up the airways. The other medication that is usually used is going to be a steroid. Typically, we'll start them on injectable steroids if it's kind of coming in for an asthma crisis. Then we'll do oral, and then we can transition to kind of inhaled steroids. Basically, like Flovent is one medication that is out there they use in humans that we use in cats and stuff. So I would definitely take your cat to the vet. The easiest way to diagnose it is typically going to be with radiographs. Okay, there's a pretty common radiographic pattern, a bronchial pattern that we tend to see with these guys. And if they do say that your cat has asthma, don't freak out, okay? You can definitely get this cat on some medications and it usually can be managed. If there's any questions about your cat having trouble breathing or just doesn't look right, then obviously rush your cat into the emergency room. But I would recommend that you go ahead and get your cat checked out before it hopefully gets to that point, because the best thing you can do is try and prevent them from having very severe asthma attacks. And that's going to be with, medications and things. All right. Vivian emailed in with a question many of us can relate to. And he writes, my vet recently diagnosed my 8-year-old beagle with a respiratory infection. The weird part is he only goes out to potty and he doesn't interact with other dogs. How could he have gotten sick? All right, Vivian. So, viruses, bacteria are just out in the environment. All right. We find them on, like lots of objects. You as a human can bring in things, even though it might not be able to infect you, and certainly can it infect your dog. Certainly things out in the environment, the plants, the grasses, the trees, other things like that. And there could have been there doesn't have to be a dog actually there. Certainly a dog could have came by that has like a respiratory infection and was left that bacteria or virus there on a surface, and then you take your dog out and then your dog could certainly get infected. I'm very sorry that he got sick, but the good thing is that most of these respiratory pathogens, if they've been properly vaccinated, usually these guys can get well very quickly. And that's why vaccines are so important. Even if you're like, listen, my dog just stays in the house, he barely goes outside. The problem is viruses and bacteria can live a very long time in the environment, and they can be very difficult to kill. So the only thing that we can do to try and protect them against it is going to be, proper vaccination. Okay. All right. So Erlen reached out through Instagram and he writes, we adopted 2 dogs from the local no-kill shelter about 6 months ago. One of the sisters occasionally starts wheezing while sitting on the couch or when we go for a walk. It doesn't last long, but what is happening? Is it an issue I need to be concerned about? All right, Erlen. So yes and no. As far as the wheezing goes, it could be kind of some allergies. I don't even know if it could be like a type of kind of reverse sneeze, possibly that your dog may be having. The best thing that you can do is to take a video, okay? And that way your veterinarian can see exactly what is going on. Because a lot of times when people try and describe how their dog is breathing, their respiratory issues, like what they're doing at home, it's very difficult, for us to determine sometimes just based on that description. Certainly having video footage of it helps us out quite a bit more. If it is something like reverse sneezing, I think I've talked about this before in another episode. It's just they get something kind of that tickles the back of their throat, kind of tickles the nasal pharyngeal area and just causes irritation. It's not harmful, even though they sound really weird and they make all these snorting noises, but it's not anything life threatening. Okay. So definitely next time your dog does this episode, all right, Erlen, take a video, then bring your dog in. Obviously, show your doctor the video, and just hopefully they can figure out what's going on. All right, we got another question that came in, and this is from Junior, and he writes, okay, and he is on Instagram, and he writes, my 80-pound 10-year-old lab had recently started making these really loud and weird breathing noises when I take him outside to play for a walk. Is this from him getting old, or could it be from something else? Should I be concerned about it? All right, so definitely it could be something to be concerned about. There is something called LARPAR or laryngeal paralysis that we do tend to see in kind of more large breed, kind of even especially overweight, older dogs. Basically what it is, so your larynx is your voice box kind of in the back of your throat. And it has kind of folds on either side of it that open and close, obviously when you speak to help you make noises and sounds. And then also too, it helps close to protect your trachea. So when you are eating, when you're drinking liquid and things like that, food and water doesn't go down into the trachea or the windpipe. When it gets paralyzed, what happens is those vocal folds don't move like they're supposed to. And so they kind of are just flapping around back there. And when that happens, it can obstruct their airway. And so they will really make these very loud sounds. And they can certainly go into respiratory distress because those basically kind of the laryngeal folds can block the airway enough to where they're not getting proper oxygen. Okay. I have seen dogs come in with like an episode of laryngeal paralysis. They can sometimes get secondary heat strokes to it because they're just breathing so hard because they're trying to get air in and they can't get any air in because they have this flap of tissue that's kind of basically blocking their windpipe. All right. It can be a little bit hard to diagnose. Usually the dog has to be sedated, very, very heavily sedated, and they will either kind of scope and look in the back of the throat with a camera, or sometimes they can just take a laryngoscope and they can do it that way, as far as trying to, diagnose that. Okay. The good thing is, if they are diagnosed with laryngeal paralysis, there is a type of surgery that can be done. Okay. It can be a little bit of a difficult surgery. Okay. So it is something that certainly that we recommend that a board certified surgeon do. And they basically, take a kind of the muscles on the side of the neck and they kind of pull them back to kind of help open up the airway. The problem is that they're more prone to having episodes where they can, get food into the windpipe or kind of aspirate because of that. But still, it's definitely a lot better than your pet having, difficulty breathing and getting overheated and all that other stuff. So, all right, best thing for you to do, Junior, is definitely take your dog to the vet. Take a video, like I said before, of the episode, okay? And then, that way your doctor can kind of see what's going on, okay? So, all right. Next, we're going to turn to Dave, who is also on Instagram, and he writes, All right. I just got a new kitten, and my other house cat has started sneezing and having watery eyes. Can she be allergic to my kitty? All right, Dave. So this is going to be the last question. I highly doubt that your cat is going to be allergic to your new kitty, but probably what has happened is that your new cat, okay, has probably brought in some type of virus or bacteria, depending on where you got the cat from. And your cat's stressed out. Okay. You got a new cat in the house. Cats, a lot of times, they're not it takes them a little bit of time to kind of get used to another pet in the house. And so, probably due to that stress, the immune system has been kind of like compromised. And so, unfortunately, because of that, whatever the kitten, brought in, now your cat has kind of got and infected with. So, best thing to do is take your cat to the vet. Probably want to take your kitten too, because probably want to see about getting, the first checkup. Hopefully it's nothing serious. Usually it doesn't tend to be. It's usually like herpes virus or calicivirus. And like I said, it's usually very self-limiting and stuff like that. But good luck with both of your new cats. So, all right, guys, I think that's going to be all that we have time for today. And as you guys probably know, I sound a little bit hoarse. I'm having some respiratory issues, but hopefully you guys learned some things about respiratory illnesses in your pets. So I wish everybody a great weekend, and I will see you guys next week. Bye.
Thank you for listening to the Health Channel podcast. We hope this information has been useful. However, please remember that only your doctor can advise you about what is best for you. Do not start, modify, or suspend treatment based on anything you have heard on this podcast. Please join us again soon.